Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer treatment and prevention. In this video, we are going to talk about transient ischemic attacks. These are like temporary strokes that happen, and you need to identify what are the symptoms. You need to identify who is at risk. You need to know what to do when you experience some of these symptoms, and how do you prevent yourself from getting transient ischemic attacks or prevent yourself from getting a stroke. So what is a transient ischemic attack? A transient ischemic attack is like a mini stroke, and it occurs when blood flow to a part of the brain is temporarily blocked. So it blocks but it relieves. And unlike the stroke, the blockage resolves and there is no permanent damage to the tissues of the brain. It lasts from a few minutes to several hours. It is less than 24 hours. What we need to be aware about is that this is like a warning sign of an upcoming stroke. So when you have these symptoms, where you get there is facial drooping, there is arm weakness, or there is a transient change in mental status, then you need to know that there is a risk of you getting a stroke. So transient ischemic attacks are important because they are actually warning sign of potential strokes. And 1 in 3 people who experience transient ischemic attacks will get a stroke within the year. So you can see that this is something that can warn you that you will get a stroke and take the necessary action. So early intervention is very critical so that you don't get a stroke and you can see the debilitating effects of getting a stroke. So what causes these transient ischemic attacks? This is due to blood clots or emboli from the heart or from other parts of the body. There is a narrowing of the cells, a process we call atherosclerosis. Sometimes if you have irregular heart rhythms, and also sometimes having a low blood pressure, or even a blockage of the arteries that take blood to the brain, the carotid arteries. How do transient ischemic attacks present? There is sudden onset of weakness or numbness of the face or arm or leg, usually affects one side of the body. You may have difficult speaking or understanding speech. You may have a vision problem, more often affecting one side of the eye. You may have dizziness, loss of balance, or even loss of coordination. You may have a severe headache with no other known cause. So when you see these symptoms, those could be signs of transient ischemic attacks. You need to seek medical attention the soonest possible. So how do you diagnose a transient ischemic attack? One, the history, if you are at risk, as we have talked about, common risk factors including hypertension, diabetes, having abnormal heart rhythms, this put you at risk. If you have a history of previous atherosclerotic processes involving the carotid vessels, this could be a sign that you could be having a transient ischemic attack. Of course, there's brain imaging, CT or MRI. There's no obvious blockage or cell death of the brain, and so the CT scan or the MRI might be normal. Of course, you need to do tests like ECG to look at the heart rhythm. If someone you think is at risk of having abnormal heart sound, an echocardiogram will help you to identify clots in the heart, and then these people you can put them on anticoagulation, which is someone taking drugs that will help prevent clots moving from the heart to the other parts of the body. And of course, there is also the Holter monitoring for the rhythm to see how is the individual's heart rhythm is. And those who have arrhythmias, then you need to give them necessary treatment. Of course, blood tests like checking cholesterol, blood sugar, and also correct clotting factors to see what are the risk factors of getting a transient ischemic attack or a stroke. So how do you treat people with a transient ischemic attack? One, as I've said, these are warning signs of an impending stroke or an upcoming stroke. So you need to put these people on anticoagulation, antiplatelets like aspirin or clopidogrel. You may also have put them on anticoagulants like warfarin or Doac. putting them on cholesterol lipid stabilizing drug, the statins, and also you have lifestyle modifications. Of course, one of the biggest risks for getting stroke or transient ischemic attacks is smoking. So if you're a smoker, quit smoking or limit your alcohol intake, because it increases your risk of getting a stroke. And of course, adopt a heart healthy diet and exercise regularly. As we have said before, this will prevent you from getting some of the risk of these conditions. So how do you prevent yourself from getting ischemic, transient ischemic attack? One is controlling the risk factors. You have to manage your hypertension, manage your blood sugar, maintain a healthy weight, address irregular heart rhythms like atrial fibrillation, and be on anticoagulation. Having regular medical checkups so that if an ECG is done, you can know that you have an abdomen and you will be put on treatment. Checking your blood cholesterol. This will help you know if when your cholesterol is abnormal and getting appropriate treatment. For those who have diabetes, hypertension, then also screening for carotid diseases might be helpful so that you know who is at risk of getting a stroke. So recognize that transient ischemic attacks are symptoms of an upcoming stroke and take the necessary action. Remember the first acronym: facial drooping, weakness of the arm, abnormal speech. Know that this is time. It is very necessary for you to take the necessary action immediately. So seek immediate medical attention, and I encourage you to subscribe to the Wellness Health Services YouTube channel for more informative content. Drop your question at the comments below this video, and also check out our channel and subscribe so that you may get more content on maintaining your health. Thank you for watching.